Now joining us is Dr. Lisa Barrett, infectious disease specialist. Thank you for joining us today.
Good morning.
Well, we're going to focus on the variant known as XBB.1.5 or Kraken. Can you give us a sense just what this variant is all about?
Yeah, it is still an Omicron variant, and it first showed up on probably the northeastern part of the US in the fall, and since then has moved very quickly to become one of the most dominant strains in the US. And so that's because not just does it spread quickly, it's because it spreads easily from person to person. Now, it also has some differences, some mutations that make it more likely to be less well seen by your immune system. That does not mean that vaccines that are currently available don't work. They probably very well do, but there's still a fair bit we don't know about this virus. And so, if I were to think about this virus, it's not that this one is so special, it's another indicator to us that this virus is still mutating and changing much more quickly than our usual respiratory viruses at the moment. And that's a real key indicator from COVID that we need to keep aware of it.
Now, you did talk about the transmissibility of this variant, and that seems to be a common theme. When there is a new variant that emerges, it seems to be so much more transmissible than the previous ones. Can you give us a sense why is it more transmissible, and is there a period later on where transmissibility of a variant possibly weakens?
Yeah, those are very true things that we see in other viruses as they evolve. I mean, COVID's a bit of a master class for the general population, unfortunately, in how viruses evolve. Of course, a virus's job is to spread from person to person, and that evolutionary pressure is one of the things that gets selected. If we see lots of cases and the ability for the virus to move and be able to be given the chance to mutate. We are certainly at that point where COVID has a chance to mutate both in North America and other parts of the world. And when there are lots of cases, that chance for mutation increases. So, how exactly this virus is so much more transmittable is not exactly clear, but viral researchers in experiments in the lab can demonstrate that this virus does hang on to cells more easily and quickly. The rest of it and how much immune escape there is, we're not quite certain on yet. But stay tuned. That is one of the reasons why we do need to continue to do work on COVID and not just pitch it back into the bucket of general respiratory viruses. We do have lots we can do about it right now. Vaccines, good respiratory hygiene culture. That's something that needs to happen right now. But we still don't have all the answers, and the precautionary principle at this point would be very useful. Countries need to keep sequencing.
To keep you going on that theme, the work of protecting yourself, what is the best means to protect yourself from something like this? Is it just a matter of keeping up to date with your booster shots?
Yeah, it's not the sexiest Sunday morning message, but it's keeping up with your booster shots. And again, all the things we've learned about being better at respiratory hygiene, washing your hands, really trying to stay home when you're sick or wearing a mask when you're out if you can't. And in crowded indoor spaces, consider wearing a mask, particularly if you're a vulnerable person. Getting tested is still a thing, particularly for vulnerable people, so that you can access therapeutics that might be available, therapies or medications that might help with COVID. Those should still work with this new variant as we start to see it come into different parts of Canada.
Okay, a message to remain diligent. Thank you very much for joining us, Dr. Lisa Barrett, infectious disease specialist.